Disasters affect hundreds and thousands of people, men, women, children. And the majority of people aren't made unwell by a disaster. However, all of those people do suffer the effects of disaster. And in fact, if we look at symptoms, it's estimated that up to 40% of a population do suffer symptoms, mental health symptoms, as a result of a disaster. And so it is very, very important. We're not talking about providing psychotherapy, therapeutic therapy through talk, etc., in terms of dealing with the majority of the issues that we have to confront. We're talking about that holistic approach that deals with the basic needs of people around the whole mantra of do no harm. We want to ensure that all of those psychosocial inputs that are being provided to the community are being provided in a culturally appropriate way. And a very good example around earthquakes is dealing with the dead. Unfortunately, none of the families, or very few of the families, will be aware of where their loved ones have been buried because of the mass graves and the mass disposal of bodies that has been going on so unfortunately over the past month. Yes, what we as mental health practitioners need to do is to ensure that there are culturally appropriate places, monuments, whereby men and women, boys and girls can come to celebrate the loved ones that they have lost. It's also going back to those basic needs, livelihood, shelter, food, etc. If we can occupy people by paying them to clear rubble, we're getting money into the community, into the economy. We're occupying, we're taking people's minds off the condition in which they find themselves and about which they're worrying, and we are providing employment. We call this psychosocial engagement, and there are many ways in which communities can be psychosocially engaged in their rehabilitation and, more importantly, their recovery.